Hello and welcome. Today we're diving into a fascinating yet potentially sight-threatening eye condition called lens-induced uveitis. This complex disorder arises when the body's immune system mistakenly attacks the lens of the eye, leading to inflammation. Understanding lens-induced uveitis is crucial for early diagnosis and effective management. So let's explore this condition in detail. Lens-induced uveitis, as the name suggests, stems from issues related to the eye's lens. Typically, the lens is shielded from the immune system. However, trauma, surgery, or even the natural aging process can disrupt this barrier. When lens proteins are exposed to the immune system, it recognizes them as foreign substances, triggering an inflammatory response. A common cause is retained lens fragments after cataract surgery. Less frequently, it can cause spontaneous lens rupture or even hypermature cataracts where the lens capsule becomes leaky. The pathophysiology of lens-induced uveitis is centered on the body's immune response. When lens proteins leak out, they act as antigens. These antigens activate the immune system, leading to the production of antibodies and the recruitment of inflammatory cells to the eye. This inflammatory cascade damages the uveal tissues, the iris, ciliary body, and choroid, causing redness, pain, and potentially vision loss. The intensity of the inflammation depends on factors like the amount of lens protein released and the individual's immune response. Epidemiologically, lens-induced uveitis is relatively uncommon, but its exact prevalence is hard to establish. It often follows cataract surgery, with a small percentage of patients developing the condition due to retained lens fragments. The risk also increases with age, as the likelihood of cataract formation and subsequent surgery rises. Trauma to the eye, regardless of age, can also lead to lens-induced uveitis. Knowing these risk factors helps ophthalmologists remain vigilant for its potential development. The signs and symptoms of lens-induced uveitis can vary, but some common indicators include redness of the eye, pain, sensitivity to light, also known as photophobia, blurred vision, and the presence of floaters. In severe cases, there may be a decrease in visual acuity. It's important to note that these symptoms can mimic other eye conditions, making a thorough examination crucial for accurate diagnosis. Diagnosing lens-induced uveitis requires a comprehensive eye exam by an ophthalmologist. This includes a slit lamp examination to visualize the anterior segment of the eye and identify signs of inflammation, such as cells and flare in the anterior chamber. Intraocular pressure measurement is also important. Additionally, the ophthalmologist will look for evidence of lens rupture, retained lens fragments, or other lens-related abnormalities. In some cases, imaging techniques like ultrasound or anterior segment optical coherence tomography, OCT, may be used to better visualize the lens and surrounding structures and to exclude other potential causes of uveitis. Differential diagnosis includes ruling out other causes of uveitis like infection, autoimmune diseases, and masquerade syndromes. Lens-induced uveitis can be broadly classified into two main types: phacoanaphylactic uveitis and phacotoxic uveitis. Phacoanaphylactic uveitis is a granulomatous inflammation believed to be a true hypersensitivity reaction to lens proteins. Phacotoxic uveitis, on the other hand, is a non-granulomatous inflammation thought to be caused by a direct toxic effect of lens material. The primary goal of treatment is to control inflammation and prevent further damage to the eye. This often involves the use of topical corticosteroids, such as eye drops, to reduce inflammation. In more severe cases, oral corticosteroids may be necessary. If retained lens fragments are present, surgical removal is typically required. In some cases, medications to lower intraocular pressure may also be needed. Regular follow-up appointments with an ophthalmologist are crucial to monitor the condition and adjust treatment as needed. Preventing lens-induced uveitis focuses on minimizing the risk of lens protein exposure. During cataract surgery, meticulous surgical technique is paramount to ensure complete removal of the lens material and to prevent capsular rupture. Prompt management of eye trauma can also help prevent lens damage and subsequent inflammation. Following post-operative instructions carefully after cataract surgery is also vital. The prognosis for lens-induced uveitis is generally good with prompt and appropriate treatment. However, if left untreated, it can lead to serious complications, including glaucoma, cataracts, and permanent vision loss. Recent research is focused on developing more targeted therapies to modulate the immune response and minimize the need for long-term steroid use. Additionally, advancements in surgical techniques aim to reduce the risk of retained lens fragments and subsequent inflammation. Further research into the specific immune mechanisms involved in lens-induced uveitis may pave the way for even more effective treatments in the future. Thanks for watching, and remember to consult with your ophthalmologist for any concerns about your eye health.